We are doing 6D taping on the Quervain syndrome. With 6D tape we mobilize the tissue in 6 directions. This will help with the lymphatic system, we reduce swelling and pain, and it enhances the recovery. For the Quervain syndrome you will need 1 time 1 handle piece pre-cut and 2 times 2 handles which is cut in half. The 1 handle activation will come into the subclavicular fossa above the clavicle bone. The 2 handles we will place in the inner side of the elbow because of the lymphatic pathways go from the medial side into the left into the venous angle here. And then we will place the cut tape here on the symptom area in the wrist and in the thumb. Taping of the Quervain. So first, if there would be any hair in the area, you should shave the area. After the shaving, always clean, regardless if you shave or not. It is recommended to clean the area of the tapes. Then you will get the maximum adhesion for the glue and adhesive. The 1 handle tape comes here above the clavicle bone to the soft spot here on the neck. Don't place it too high on the neck, but here on the soft spot. Head should not be turned to the side, it should be on normal position, looking straight, and then also muscles relaxed. The skin should be room temperature, not sweaty or wet. When you work with the 1 handle, you take just 1 small piece from the end of the tape. You remove the packing paper, you remove the small piece, and then without touching the glue you place the handle. First the other end of the tape and then the other end. You can place the handle on horizontal or vertical so that the patient gets the best grip from the handle. That is the idea how to place the handle. For the elbow, don't bend your elbow or extend it all the way straight. Small angle for the elbow, and then just place 2 handles there. You cut from the between the handles, small piece, and then you just pull back and the tape back paper is cutting into half. Remove the packing paper. Don't stretch the tape. Place the tape so that the middle part comes to the middle of the elbow. And first the other end. Remove the back paper and glue the tape into the middle of the elbow. For the symptom area, you should place so that the cut half comes here on both sides of the thumb, and the 1 full piece comes around on top of the tendon area. You cut so from the middle of the handles, and you look first how you can best reach the other half of the tape, approximately like this. And then we just tape first the lower end. You have your fingers all relaxed, wrist in neutral position, and then when you tape the endings. Once again, you use the backing paper as a protective paper, not to touch the glue. And then the other end. And now when you make a small turn, you can slightly stretch so that you won't get any wrinkles into the tape. So just a tiny, and then we place it on the other side of the thumb. And press it well into the tissue. You let it adhere the glue for 15 minutes and it will reach the maximum bond of the adhesion. For the treatment of the Quervain syndrome, so you will start activation here on the subclavicular fossa. You pump the tissue about 15 to 30 times, about 1 minute. This activates the whole lymphatic system of the arm. And you never pull the tape so hard that the handle or the tape comes off or it creates pain. Then you go and continue by lifting up and releasing the elbow area, creating some space so that the lymphatics flow can go into the venous angle and back to the blood circulation from there. So here in the elbow, about 1 minute activation. Then we go into the target area and there we start in 6 directional activation. When you go down, you have to remember that you don't press so hard that you create pain. If it's painful, then use all the other 5 directions. And we manipulate about 5 minutes. All the directions can be used here in the thumb and wrist area. Then after around 5 minutes, you continue with the elbow, about 30 manipulations. And we basically push the lymph flow first here to the elbow. And then when we go down, we push it here into the venous angle. And 1 minute, 30 manipulations here. And it goes into the blood circulation. The treatment should be done every 3 to 4 hours. You can wear and keep the tapes around 2 to 4 days, but that is individual, depending a little bit of the skin type of the people, and then also about the humidity. Thank you for watching the Quervain syndrome taping with 6D handle tape.